Good morning to everybody out there. My name is Volker Winkler, and I very much welcome you to the Global Health Academy Heidelberg 2021. And we have the topic, which you probably all know, COVID-19 and equity, regional and global changes. The Institute of Global Health Heidelberg, together with the graduate school here in Heidelberg, are hosting this academy, thankfully in cooperation with the Institute of Global Health from the University of Geneva. The Kröner Foundation funds this academy and also the graduate school, as you may know. And let me give you some brief introductory words. First, to our graduate school, which aims to equip medical students for a successful career in global health by providing necessary skills and competences with an interdisciplinary perspective to tackle the global health challenges. Even though global health is, or maybe I should even say, was perceived as a rather theoretical construct, especially by the German public, it is now changing. Generally, it deals with a wide range of burning topics, such as climate change and its effects on health, which are widely discussed now. The spread of antimicrobial resistance, which is like a common problem known for years. Migration and flight, which is very much discussed in the public, especially in the past years. And also, of course, challenges to the health system, which come, for example, by demographic changes, which are facing many countries. And last, not least, of course, the SARS-CoV-2 pandemic, which still affects our everyday life, probably for much longer. And especially this pandemic, and also all the other topics, of course, show the need for global health research and capacity building to develop like comprehensive and evidence-based solutions for these many global health issues. Particularly in this sense, we are happy to have been able to organize this event. Altogether, it was quite challenging, but now we are even more excited to see how it's going to evolve within the next 2 days. And with these short words, I hand over to my colleague, Florian Neuhan.
Good morning. Actually, I thought we rather switch to our Geneva friends first. I think that might be the better order of the events. So Eric and Jelena, please, if you go first.
Thank you, Florian and Volker, to host us. So I introduce myself. I am Eric Comte, and I am the director of the Geneva Health Forum. Jelena, my colleague, will present you after my presentation, will present you more what is the Geneva Health Forum. I just want to remind what are the origin of the Global Health Academy that we are running for the first time today. The Global Health Academy was planned, in fact, to be done during the Geneva Health Forum in March 2020. But because of the COVID situation, we were obliged to cancel it. So is why now we are doing it still only in video, and we will be happy maybe for the next edition to do also in a face-to-face meeting. The idea of the Global Health Academy, it was to give opportunity for the student in global health to meet expert or factor of global health. Expert or factor coming from sector or coming from international NGO or organization. We want also to facilitate the networking for the student who are working in global health, and to give them the opportunity to meet a network that could be useful for the future career. So is why we organize during this academy some small workshop in order really to facilitate the direct contact. We want also that the students are able to discuss directly with the speaker during the training. So is why we will organize the academy as a free kind of activity, the session where you can learn from the expert, the poster session that some students can show their work that they already done, and the workshop, as I say, to interact directly with the student or the speaker. The Global Health Academy is organized in cooperation with the University of Heidelberg and the University of Geneva, and we are very happy of this cooperation. But the students themselves come from 18 countries and then come from 24 organizations or universities. So it shows the richness of this network, and I am sure that we'll learn from each other during this 2 days. And I'm sure also that after this 2 days, we'll continue to be in contact. So now maybe I let Yelena to introduce and to present maybe a bit more what is the Geneva Health Forum. Yelena.
Thank you, Eric, and good morning, everyone. So my name is Yelena Milinkovic, and I'm Director of Operations at the Geneva Health Forum. And we are very, very happy that we have been able to co-organize this event together with the Heidelberg University. So yes, to give you a bit more background on what is the Geneva Health Forum. Well, the Geneva Health Forum is a forum co-organized by the University of Geneva and the Geneva University Hospitals. Since 2006, the first edition has happened in 2006. And since then, every 2 years, we have had a major conference happening in Geneva on global health. So why in Geneva? It's really the so-called capital of global health. We have many actors, international organizations and the WHO, but not only, we have also many NGOs, the academic field. And really the Geneva Health Forum aims at bringing all these people together, international organizations, actors from the field, policymakers, academic institutions, and it's really trying to bring a voice to actors from the field, trying to bridging the field, real experiences on the ground with policymakers, and try to have them have a voice in the development of public policies. So this is what we're trying to do. We're bringing 1,500 people together usually. And soon will happen the 9th edition of the forum. It will be held in May next year, from 3rd to 5th May 2022. So save the date already. It will be on COVID-19 pandemic and environmental emergency, reinventing global health in times of global changes. So also to give you an information that I think can be of interest to you, we have just launched a call for abstracts, call for contributions. So any project, research in the field of One Health or planetary health, given the fact that it's really our focus for our conference next year, is welcome. All the information can be found on our website, www.genevahealthforum.com. So don't hesitate, we will be very happy to receive your contributions. They can be in the form of a poster or an oral presentation or even an innovation. So with this, I think I give the floor to Florian. Thank you.
Yes, thank you, Jelena, and good day, whether it's morning, afternoon, evening, or even night, wherever you may listen to us. We hope more people are going to join. My name is Florian Neuern. I'm one of the co-organizers from Heidelberg Institute of Global Health. And I want to bring us back to the event now. The concept that we developed together with the Geneva colleagues of the Virtual Academy entails, on the one hand, the skills workshops, as Eric Comte explained, and together with a focal theme. And at this time, COVID, the SARS-CoV-2 pandemic appeared like a pressing theme, and we will look at it from various angles: geographical representation, and that also entails and means that we have socio-cultural aspects. We will look at the medical part of the pandemic, as well as public health measures and perspectives. And we will, in the panel discussion, also touch on the political and economic recuperations and implications. But we added in the topic actually the term of COVID and equity. COVID infections have clocked now an estimated number of infections that reaches 250 million around the globe. And on the other hand, around 5 million people have died attributed to COVID. This number might be a severe underestimation and does not include deaths that have occurred for other causes because of the breakdown of services, or cases that have not been tested or reported or registered. And we see a lot of inequality in the pandemic across the globe, within regions, countries, and societies. Which of these inequalities, however, are inequities that require action under a kind of moral obligation, and as well as in a strategy that effectively and efficiently contains and controls the pandemic? And how can this be embedded in a broader concept, such as the SDGs? In particular, of course, SDG 3, that tries to ensure healthy lives and promoting well-being for all at all ages, and without neglecting other pressing issues. We hope that with our program, our academy will stimulate thoughts, discussions, ideas that are carried further in your local, regional, and global context and networks. And as Eric said, we are hoping that the contacts and networking we do now will continue. And I think this is my statement and introduction for this. We are pretty excited and hope that it will be a successful event. And I will hand back to Volker and to explain the next step. And I think we will have the first round of workshops pretty soon starting. And what I just wanted to say, please also, because the dean of our faculty could not make it in this morning session, but please appreciate his welcome address in the platform as well. Volker, over to you.
Thank you very much, Florian. So the official or the planned idea is that we now switch to the workshop rooms. So basically now there are 2 workshops which start in about 15 minutes. So at 9:30, the workshops will start, the first 2, which you can see in the schedule. However, I'm not yet completely sure if the writing workshop can take place due to some illness. However, please just come to the room and we can discuss how to continue, and the other workshop will just start as planned. So enjoy the whole conference, please. Take the opportunity to network, to ask questions, to talk to colleagues, specialists from practically all over the world. We try to make that as good as positive experience for you all with this online conference. So let's make the best we can from the next 2 days, and yeah, enjoy.